Hello everyone, you are watching sqadia.com and I am Dr. Hamad Hazar. Today we'll be discussing mainly the topic which is revolving around the patella, that is the patellofemoral injuries. We'll be discussing first the extensor mechanism injury. As you know that the quadriceps tendon, which is actually formed of the four muscles, that is the rectus femoris, vastus medialis, intermedius and lateralis. They form a conjoined tendon eventually attaching onto the patella or the superior lateral borders of the patella called as quadriceps tendon. If that gets ruptured, we will be resulting in a loss of extension at the knee joint. We'll be also discussing that once this tendon joins the patella, then it actually encompasses patella itself, and patella is the largest sesamoid bone which is present inside the tendon, and then it becomes the patella tendon. As this combined mechanism is actually responsible for extension at the knee joint, so it is patella tendon rupture can also result in the loss of extension at knee. We'll be discussing patella fractures, as our discussion will be mainly revolving around the patella, which could be directly due to trauma or could be indirectly due to eccentric contraction, especially during a flexed knee. Then we'll be discussing the classification of patella fractures, although there are different ways of classifying patella as per displacement. It could be minimally displaced or completely displaced, or then it could be on the basis of geometrical classification as well, whether it's a longitudinal, it's transverse in multiple community leading to stellate type, or it could be a vertical fracture of the patella. Then we'll be discussing the patella dislocation. Although most commonly it is secondary to acute trauma, but it's maybe associated in certain individuals such as which may have increased hyperlaxity or hyperlaxity syndromes, and there may be associated with increased hyperextension at the knee joint as well. And when we will be discussing mainly these, the most important aspect we'll be discussing is the loss of extensor mechanism at the knee joint. As you know, that extensor mechanism is actually required for a proper knee functioning. Thank you very much. Keep watching sqadia.com.